I'm Lieutenant Governor Mandela Barnes. I'm here with Dr. Marcia Slattery from the University of Wisconsin School of Medicine and Public Health. You're Professor of Psychiatry and Pediatrics, Director of the UW Anxiety Disorders Program in the Department of Psychiatry, and Clinical Director of the Office of Continuing Professional Development. A lot of titles, a lot of words.
A lot of good stuff.
A lot of great stuff, a lot of necessary stuff. I think that's the most
Yeah.
important part about it, especially at a time like this. I'm sure there were times people were like, what are you going to do with all that? Well, now we know. And you know, your expertise cannot come at a better time. So I really just appreciate you joining me, sharing a moment of your time, and also just taking a moment to connect with people to, you know, talk about ways that, you know, they can help make sure that they maintain some semblance of normalcy, which is not easy at a time like this. And isolation is a real thing, and it impacts people in a different way.
Yeah.
You know, we talk a whole lot about stopping the spread of COVID-19 and how do we make sure that people stay physically healthy, but the mental health component isn't always there. And it's something we have to be very conscious of right now, especially with, and I was going to say with our young folks, but really every age.
It affects everyone. Exactly.
Dealing with it. Exactly. So not to take up too much of your time, I would just start out by asking, how is your practice changing with COVID-19 and safer at home?
So our practice has moved to complete telehealth in terms of outpatient appointments. So right now we're doing that all by telephone calls. We're seeing all of our patients that we normally would see, but we're doing it by telephone calls. In the very near future, we hope to have video capacity as well. But all of us are working out of our homes. We do have our inpatient units open, of course, for the more seriously ill or acutely ill, but for the most part, everyone's having their practice at home, but seeing exactly the same volume, and in fact, more people now because of the obvious stressors that it's causing.
Yeah, I couldn't even imagine being in your position, you know, and also just thinking about people who are already dealing with issues, already dealing with the physical or especially the mental health issues. And this, honestly, I can't, you know, this couldn't have come at a worse time. And it's not a thing that, you know, we predicted. It's something we could have, you know, there could have been more action obviously done on the front end as far as the response. But we're past that point now. We have to figure things out. We have to respond in the moment that we're in. But how do you see COVID-19 affecting youth and families the most?
Well, I think the biggest piece is the stress piece, as you mentioned. It's just, you know, initially what we saw, there was just this acute stress and a shock quality to it, right? So much change so quickly. You know, kids are out of school, parents are out of, you know, not in their jobs anymore. Things were closed up. We weren't supposed to leave our homes. We were introduced to these concepts of social distancing and testing, all of which was new. And so I think everybody was just shocked. And what you're seeing more of now is more of a chronic stress model. And that's really what we have to pay attention to from the standpoint of our health, just not only our emotional health, but our physical health as well. The chronic stress that tends to build up, you know, initially we've got all these stressors and we find ways to deal with it. We establish new routines, etc. And now we're kind of getting into that stage more of wear and tear. Resources kind of are going down. We're getting a little impatient. We're saying, you know, this is just getting hard. And that's a very important piece that people need to pay attention to. We're not very good at paying attention to stress. Stress itself is not bad. Some stress is actually good for us because it pushes us forward. But when it gets to be more of a bad stress, it's when the demands or the changes sort of outstrip what we can do. And that's what I think people are really starting to feel more of now.
Yeah, the multiple stressors part, it can't be understated. There's just stress from so many different angles. There's financial stress for so many people. There's the health stress. There's also just so many contributing factors that will add much more stress to a person's life. You have to figure out, how do we get the kids educated, because we're now teachers, we're now homeschooling, given everything that's going on. And people in professions that are typically around a bunch of folks too, people people who are extroverts as well. I mean, that is also that can bring about a lot of stress, because you know, the just being around other people helps you, and you can't see your family members. I haven't seen my parents in at least a month now, and that stuff, it gets very stressful. But I would, if you could just talk a little bit about multiple stressors that are longer lasting and how they can wear us down.
Yeah, I think you really touched on a key concept that you were just talking about is we've basically lost control over a lot of pieces of our life, right? We lost what our normalcy was, and that's what can be really stressful. We can't do the things that we want, and that's frustrating people. And I think that's what's contributing to a lot more of that stress pieces. And I think, again, going back to the stressors, the obvious things, we have to think about what things can we not control, right? We can't control the viruses out there. We can't control the fact that we have to be home, et cetera. But there's a lot that we can control, and I'll come to that in a minute. But more importantly, I think people need to get dialed in better about how does stress affect me? We're really bad about identifying that, and it will happen to all of us. So this is not something that's going to only happen to some of us. In some way, shape, or form, it's going to affect all of us. And really, what's going to be very smart and important for us to do is to recognize that, because it allows us to stay on our game. It allows us to be on our edge and to be able to make the best decisions. Because if not, it's sort of insidious. It's there and it starts to wear on us. So, for example, physically, people start to describe feeling, I'm really run down. I just don't feel like I have energy, or just kind of blah. I just don't feel good. That's the physical components of stress. The emotional components of stress very commonly are things like irritability. I'm getting frustrated more. You annoy me more, right? All of the things when we're just in that wear and tear. And that can also lead to more depression and anxiety. And then just functionally and cognitively, we don't remember things as well. Like, where did I put things? Or I can't concentrate as well. Or people will say, I feel like I'm walking in circles and I'm not getting anything done. All of those things are pieces of stress. And if people recognize that, then we have ways of saying, all right, I describe it like, for COVID, they tell us we should be taking our temperature, right? Because a fever is one of the cardinal features of the illness. Well, for stress, one of the important things I think we need to get better at is that we need to have a thermometer, much like we take a thermometer to test our temperature. We need a thermometer that we think about every day in terms of taking our stress temperature, our emotional temperature, and just to pay attention to it. Because when we do, then we start to say, I have been kind of run down, or I have been more edgy. Here's what I need to do to chill and get back to a calmer spot. Because if you don't, it absolutely will escalate. And that's where we get into more problems. So you see more arguments, family arguments, that, if left unchecked, can definitely increase the risk, that we could get into abusive situations of domestic abuse, child abuse, and elder abuse. People get more physically ill. So if it's left unchecked, it definitely can go down that course of severity. And if we're smart about it, and that's really the important message for people to hear, take your stress and emotional temperature now, every day, and talk about it in your families. I like to draw it out, draw a thermometer and put it on the front of the fridge or somewhere, right? That reminds us, hey, I got to just kind of check in with myself, and have the discussions about it with your kids, just to say, how are we doing today? It's inevitable we're going to maybe get a little argumentative or irritable. Here's what the plan is if we do, so that we don't have that escalate.
Yeah, that makes perfect sense. And a lot of people, like you said, people feel out of control. And you can think about folks with, I don't think I have a type A personality, but people that do have more of a type A personality, people that want to be in control. And also you think about folks who are more individualistic, who have individual personalities. They just want to be, independent by themselves, but they are in situations where they are, self-isolating, quarantining, but with a partner, with other people. And that can be very difficult. Like, just the stress of the presence of other people constantly, that can wear down on a person the same way that the stress of a person who has an extroverted personality is going on without people. I'm really glad that we're having this conversation. And
I think of it, almost it's like, I think of it this way. It's like you're in the car with your family, right? The summer vacation.
yeah,
This is not a ride across the other side of town. This is like getting in the car with everybody, right? And the dog, and going from coast to coast across the country. we have to pace ourselves, and we have to interject positives and be aware of how do we get along together in this smaller space, but to know we're not in it just like it's not going to end next week, but we really have to pace ourselves. And I think that's an important model that people have to recognize and embrace.
Yeah, and even with the car metaphor, and it's like there's still people. Are we there yet? Are we there yet? Are we
Yes,
there yet?
exactly,
I don't know
exactly,
if we're there yet. I don't even know which direction we're headed. I don't know
exactly,
if we're even going the right way.
exactly.
So, if we don't recognize and manage our stress or anxiety, negative outcomes we know are very likely. So, what can stress in the short term lead to?
Well, I think in the short term, again, you feel more of that acute, when people are acutely stressed, that's when people will say, like, my heart is racing, I'm short of breath, I'm tingling and tense. That's more of an acute physiological response of stress. When it's more chronic, you can still have those episodes where your body, because our body and our brain are intimately connected. So if our brain is feeling stressed, you can be sure that your body is going to feel and take a hit too. And so the more chronic is when you get more of that rundown, the physical things, and it absolutely wears on your immune system. So that increases your likelihood of getting sick as well. But that emotional piece is really important. And when we're stressed and when we're more irritable, we lose that filter. When we're calm, we can kind of decide, right? Like, what do I want to say that, but maybe that's not a good choice of words for me to use. When we're stressed and more irritable and on that thermometer, we're higher into that irritable, angry phase, we lose that filter. So we're more likely to say and do things that we would not do if we're in a calmer state. So again, the goal is we have to keep tabs on it because we can't change it if we don't notice it. So number one is to notice, where am I at? And number two, if I notice that I'm going up on that thermometer, what's my plan to bring me back down so I can get more into a calmer, more rational space, which allows that more rational part of our brain to think about what's the best choice for me to how to handle this right now, rather that impulsive emotional piece.
Yeah, and so what about longer term stress?
The longer term stress, again, it depends on how well we adapt to it from the standpoint of if we recognize that and we're being very proactive about things that keep us healthier. So physical exercise, huge for all of us. So everything I'm talking about is for kids and for adults as well. So physical exercise, finding positive things to do together with your family, right? And pacing that out. And also finding quiet time, even in our homes. Everybody needs some quiet, private space. People find different ways to what helps them relax. So it might be meditation, it might be prayer, it might be I'm involved in an activity that I really enjoy, so this gets my mind off of it. Things that just let our body and our brain just relax and de-stress. The more that we do that on a day-to-day basis, the less likely that that's going to build up on the thermometer. But if we ignore it, and we only do it in the moment, then it's going to be harder to manage. The key is if we do these things every day on a steady basis and really put it into our schedules at home, that will decrease the likelihood of these things building, which will keep our bodies physically healthier as well as us emotionally healthier, keep us cognitively healthier, which altogether will just allow us, as I described, being on your game, being able to make the best decisions, being able to feel good at what you do and keeping your edge. So I think of it proactively. This isn't like a weakness. This is being smart and thinking ahead. How do I stay on my game?
No, absolutely. And stress and anxiety arises and it falls.
Yeah.
It can come in waves. And if we can kind of compare it, if we kind of look at it that way, you think about us and looking at COVID-19 and how we need to flatten the curve. How do we work to flatten the curve of stress and anxiety in our own personal lives?
Yeah, it's a great point because as contagious as COVID is, stress and anxiety are tenfold more contagious.
Hmm.
And so again, keeping under, in our own ways of how we're keeping ourselves steady is really important. But I think it's again doing that on a day-to-day basis of monitoring where we're at, managing it and doing these healthy things on a proactive state every day is really what's going to help us so that we don't have the longer term sequelae that can happen very easily.
Yeah. Um, so what about, possibly developing new routines at home? How does that help? What can people do?
Routines are central. They're huge. Our brain functions best when it knows what's going to happen. And we don't really pay attention to that on a normal basis, right? We go to work and things may come up at work, but we know what the flow of the day is going to be. The same thing at school. Kids know when I have math, when I have reading, when I have recess, etc. So it gives our brain a map, sort of like, here's what's going to happen, because we inherently want to know what's going to happen. We want to be prepared. Our brain kind of wants to know. And so when that was taken away, that caused a tremendous amount of stress because we were in this sense of ambiguity. And there wasn't a grounding, if you will, of the routines. So extremely important to set new routines. That's one of those things we can control. So in our homes, developing new routines and schedules. For kids, I really emphasize for parents, write it out, sketch it out for the day, every day, and put it again somewhere very easily seen, like the front of the refrigerator. It's good for adults too, because you just pass it during the day and you see it, and our brain, you may not pay attention to it overtly, but your brain does. Like, here's what's going to happen. I know what's going to happen. And it gives you that sense of control. So routine and consistency in your day is really important. And to build in things like physical exercise, what I call brain exercise, that's like for kids for schoolwork, for us, like our work and reading and things. Staying socially connected with people in our lives, and just having that quiet time too, that we literally schedule that into our day. If we do that, again, not going down to half-hour spots, etc., but trying to think about getting that into a day and balance that through the day, the long-term outcome will be much better because there's now a plan, there's now a predictability, and we're doing things that keep our brain healthy in different ways. I call it like cross-training for our brain. The more we have variety, the more flexibility and cognitive abilities that we're going to have to make good decisions.
And so what about check-ins and meetings? And, so you talked about self-monitoring, you talked about the thermometer and making sure that you yourself are fine. But, for those of us, or not myself, but for people who have families who are living with other folks, how important is it to have regular check-ins and regular meetings? And what should
Yeah.
people talk about at those meetings?
Oh, it's a great question. So the way that, we have to work together as a team when we're home with our families. And the biggest mistake is we all go into our own rooms, right, and be on screens. It isolates us more, which can make the stress a lot worse. So what I recommend to people is set a time every day. It doesn't have to be long or complicated. It might be over family dinner in the evening, but it might be like early evening, it might be in the morning, but have, again, a consistent time when the family, I call it like a family meeting or a check-in. And you basically say, how'd the day go? If it's at the end of the day, how did today go? What went really good? And I really encourage people to give a positive comment to everybody, right? We don't do that very often, and we don't do it very well. It's not something that comes automatic. We're very quick to give the negative and critique, but to actually give a positive, I would say it's like giving a gift. Tell somebody something positive. So how'd the day go? What didn't go so good? And how do we want to look at that, maybe making it better tomorrow? So it's a very enduring sort of interactive every day of checking in and just keeping that communication open. It doesn't have to get into things deep, but just what's the plan? What worked good today? And what do we want to plan tomorrow? So that we also make sure that we build in family enjoyable time, right? That we actually, when we're with each other, we can enjoy it. And it's important for all family members to have input into that. What could we do? And plan that together. That communication, and for parents to keep that communication open with the kids, is critical. Don't do it hit and miss. Really have it on a daily basis, just short, hey, how's it going? What you doing? What you thinking about? It doesn't have to be deep. But keeping that communication track open, you're more likely to hear what's going on and what they're thinking about than if you do it hit and miss, because they're just not used to that. Like, why are you asking me? So more that you keep that flow going, the more likely you're going to hear it. And the same thing for parents, right? They need to keep that communication among themselves. Hey, how are you doing today? I think I need a break. Can you take it? So that communication between parents and kids with parents too, that they feel they can bring their questions and their concerns to their parents. So communication is key, and finding a time to do that on a daily basis can really help.
Yeah, these things aren't easy, right? Like, I don't want to get anyone confused. Like, this is a challenge that we're all in, and we have to adapt
Very much.
to a set of circumstances. And
It's all new. It's all new, and we're sort of defining as we go along. But these are basic principles that, it's the simple things we're not very good at and we ignore that get us in trouble. So the more that we really stick to these cardinal anchors, as I described, the more likely things will go better. And we can adapt during the day. Things obviously are going to come up and we can be flexible. These are like anchors for our day, which are really important to give us some sense of semblance of what we're going to do today.
Yeah, and I just really appreciate your expertise because a lot of these things we just don't think about, and we can see ourselves being overcome by stress and sort of think that it's normal and there's nothing that we can do about it. But in fact, there's a lot of things that we can do about it. It may not make things perfect, but it can certainly make things a lot better, which is important in a time like this where we have to pace ourselves because being overburdened, overwhelmed with long-term stress is not healthy. And not only will we be mentally sick, it can actually make us physically unwell. And we have to protect ourselves on as many fronts as possible, internally and externally. These are trying times, and we're asking for a whole lot from a whole lot of people, but we also, at the end of the day, are asking people to keep themselves and those around them healthy. Because if you're overcome with stress, if you become unwell mentally, that will impact those around you. And like you said, the stress is 10 times could be 10 times more contagious than the virus. And if we have just so many people who are dealing with the stress, who are dealing with the mental ramifications and the physical ramifications, it will spell out disaster. So please, 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 I am going to make sure that I incorporate that into more of my messaging. I don't talk about it as much. I do a little bit, but not enough. And I want to take that pledge right here and right now to say that, as much as I talk about being physically well, practicing the safe social distancing to make sure that you don't get sick or get yourself or get others sick, that you also pay attention to your mental health and check in on the other people as well. If you're calling your relatives who may be in a vulnerable population, but there's really no such thing as a vulnerable population because people who thought they were young and healthy are also getting sick and losing their lives to the virus. But as you call and check in on your friends, your family members, and neighbors to ask if they are feeling symptoms of the COVID-19, whether it's fever, shortness of breath, the cough, or whatever, or coughing or whatever, we should also ask, are you feeling mentally well? Have you taken personal time today? Have you had a chance to kind of clear your thoughts and reset? Because we're going to need to reset every day. And not only from the isolation part of it, also watching the news because things are frustrating. And it feels like there's literally nothing we can do. And so that can also wear down on a person. I think it's important for us all to reset at the end of the night, and the people that you're checking on to see about their physical well-being. Please also be concerned. Concern yourself with their mental well-being as well. So, Dr. Slattery, I'm not sure if you have anything that you want to close us out on. I just want to thank you again for coming on and taking a moment to talk to people. So I would love to hear if you have any closing statements.
No, I really appreciate the opportunity to join you today because it's such an important topic. And like I mentioned, this is going to affect everyone. It's not that this is going to affect only the elderly or only the young. This is for all ages. Stress affects all ages, all of us. And we can manage it much better if we pay attention to the physical signs, the emotional signs, the cognitive signs, right? And keep our temperature, if you will, and noticing what that is and do the things every day that we talked about. That will keep that at a manageable level. So there's so much that we can do, and I really want to emphasize this is being proactive to stay healthy. This isn't talking about a weakness or I can't do something. This is like being on your game and staying healthy. And that's really what we need to get the message across. We need to stay at our best during these times of very trying stress.
Yeah. Well, thank you so much. Thank you for taking the time. We appreciate all the work that you're doing, and we appreciate you just taking a moment to share your expertise with folks. And are there any resources that people can immediately reach out to if they need help?
Well, certainly we're going to be working with the state, the Department of getting information out. At University of Wisconsin for the medical school and the Department of Psychiatry webpage, we have a lot of resources there in terms of stress management techniques for general management for kids and families and for healthcare providers. So that's another site that people can check out as well.
All right. And as always, dhs.wisconsin.gov for up-to-date information on COVID-19 and the spread, and also resources to help you manage through these very difficult and trying times. Dr. Slattery, thanks so much for joining.
Thanks for having me. I really appreciate it.
Yeah, no, I hope you have a great weekend. I hope that you are also, checking in on yourself, because a lot of times the people who are doing the work don't always have the time to make sure that they themselves are doing well. So I hope that you have a good weekend and a
Thank you.
chance to reset and rebalance.
Thanks so much. Glad to join you.
All right, and I hope we'll talk soon.
Very good. Thank you.
Thank you.